Good day, my name is Paul WRAG. I'm an application specialist for InsightTech. Many people associate surgery with trauma. I'm sure you do too. Do you have any friends or relatives that have suffered with uterine fibroids? Just recall to mind their experience. What did they go through? Do you see this area? This is uterine fibroid. Uterine fibroids are a very common problem. It's estimated about 80% of women will suffer from uterine fibroids during their lifetime. They are not life-threatening, but they can cause a large amount of symptoms and discomfort in women, such as intermenstrual bleeding, heavy menstrual flow, along with severe cramps and excessive fatigue, pain during intercourse, frequent urination, and swelling of the abdomen. Let me ask you, is removal of the uterus or surgery the only option? Thankfully, the answer is no. Technology has improved greatly to relieve the patient of stressful surgery. InsightTech's ExAblate 2100 MRgFUS system is the answer. MRgFUS stands for Magnetic Resonance Guided Focus Ultrasound Surgery. In simple terms, we take away the surgeon's knife and use ultrasound waves instead to destroy the fibroid. The sound wave is focused into a single point, similar to using a lens when focusing light waves. The sound wave has the ability to pass through the patient's skin without damaging anything until we get actually to the focal point. We use the MRI to visualize and target the area we wish to treat. We apply the ultrasound energy and scan at the same time. This allows us to see the heat rise at the focal point as it occurs. The procedure is a high precision treatment with each application of energy being called a sonication. This ultrasound treatment does not affect any surrounding tissue and does not involve any irradiation. About 8,000 women worldwide have been successfully treated for uterine fibroids with this breakthrough technology. Everywhere we go, we have women thanking us for this great procedure. This is the latest, most advanced, state-of-the-art MRgFUS system, the ExAblate 2100 by InsightTech. This is the first such installation in India and the 90th system to be installed worldwide. It provides 3D high-definition imaging, real-time thermometry and assessment of the patient outcome. In simple terms, it means you get real-time measurement of the surgery with continuous feedback and monitoring. It is FDA approved, and I'm sure you know how stringent the FDA are. It took hundreds of patients over 4 years to get FDA approval. It is a product of InsightTech in partnership with GE, and it is brought to you in India by Concept Medicare. Apart from uterine fibroids, other applications of this machine are for the treatment of adenomyosis, painful bone metastases, with research going into breast cancer, prostate cancer and many other areas. The infrastructure at Concept Medicare is top class and the doctors very experienced. Hi doctor, how's your first patient doing?
Yes, she's fine. In fact, she's a gynecologist herself. And we were able to ablate more than 80% of her fibroid, and she went back to her clinic the very next day.
Now, that's amazing, isn't it? Being able to return to normal work the very next day. Doctor, for the benefit of the audience, could we summarise the benefits of this breakthrough technology? The first point that occurs to me is that the uterus need no longer be removed. Is that a good thing, doctor?
Of course, if the woman wants to have a baby, the uterine fibroids should not be challenged anymore with ExAblate 2100.
Apart from being a doctor, you're also a woman. I take it that you're speaking for all women.
Yes, sure. See, there are no incisions, no anesthesia, and no scar marks.
Okay. An outpatient procedure, no hospitalisation. Ideal for working women who can't take long-term leave.
Yes, of course. And moreover, patient's relative can stay inside the MR suite while the procedure is being done, and moreover, they can hold patient's hand and make them as comfortable as possible.
Yes, I forgot about that. That's a good point. Also, I would add, a low rate of complications compared to traditional surgery. Plus, it can treat large fibroids up to about 10 centimetres in diameter.
Sure. Last but not the least, the patient can go back to the work the very next day.
That's it, folks. I leave you with Concept Medicare.